Good afternoon, my name is Bianca Zavala, and for this assignment of Exceptionality and Connections to Speech, Language, and Literacy assignment, we will be discussing a language disorder which is DLD, also called Specific Language Impairment, and it is now known as a developmental language disorder. So there are 3 challenges that children with DLD may face. The first one is word finding difficulty. DLD is known to impact a person's ability to understand and use language. However, it rarely occurs in isolation. It is a diagnosis given to a child primarily by a speech-language pathologist for someone who has difficulty speaking and understanding language, as described by the researchers at the Queensland Children's Hospital. So people with DLD struggle with expressing themselves and comprehending language that is spoken to them. So they may have a processing delay of communication. So this means that they will have difficulty in finding the right words. And yes, we all face the struggle of having the word at the tip of our tongue, but children and individuals with DLD face this on a clinical level, as described by Dr. Hill in a video interview. So another challenge that people with DLD face is they have a hard time with vocabulary advancement. So children with DLD struggle to find the words they want to use in communication, which includes using new vocabulary that they are introduced to in the classroom. So along with this, they might not understand instructions or be able to follow conversations, which leads them to have difficulty in saying sentences or explaining their ideas, which is what Mrs. Yeatman, who is a speech-language pathologist, has described in their video interview on a podcast. Children with DLD often struggle to learn and retain new words, so they may have a limited vocabulary compared to their peers, and they take a longer time to grasp the meaning of words, which affects their ability to express themselves clearly and understand others. Another symptoms speech-language pathologists look out for when diagnosing children with DLD is directly observing how children carry out the instructions that are given to them, because children with DLD would have a hard time following instructions because they may not understand the words that are spoken to them. So since DLD is a language disorder, this affects how they understand words as they hear, and they have a different way of processing language, which is not the same as their peers. So DLD is often considered a hidden disability because it's mistaken with a problem with their behavior or attention, because they respond to directions differently, they respond to communication differently, they respond differently than their peers. So this makes DLD a lifelong condition that can have a lasting impact on how these children make friends and how they learn at school. So moving on to the challenges that children with DLD face in their literacy development is that these symptoms are sometimes hidden because the symptoms are not immediately seen or tangible, as we spoke about. So even though these difficulties children face in retaining vocabulary and identifying sounds and connecting meanings to them, this in turn affects a child's abilities to read and write. So therefore, as Dr. Libby Hill, which is an award-winning speech and language therapist, quote, said, "What an individual can hide with their spoken language, they cannot hide in their written language." So this is why there are other learning disabilities that overlap with DLD, because if somebody has dyslexia, this means that they are more than likely facing specific and fundamental problems with oral language, which affects an individual's awareness of sounds, their expressive language, their social communication, and understanding of speech, which is closely related to DLD. Another symptom that impacts a child's literacy development when they have DLD is that since DLD is a neurodevelopment disorder, as stated by the National Institute on Deafness and Other Communication Disorders, this disorder is not necessarily something children just grow out of. Also, the causes of DLD are not exactly traceable. So the challenges that children may face in their early years because of DLD may follow them into their adolescence and even adulthood, since they may reach spoken language milestones much later than other children. They will struggle with translating letters into sounds for reading. Their writing skills may be weakened by grammatical errors. They may have limited vocabulary and problems with comprehension and organizing thoughts into sentences. So this in turn means that reading is something that's going to be difficult for them, and by the time they reach adulthood, people with DLD are actually 6 times more likely to be diagnosed with reading and spelling disabilities and 4 times more likely to be diagnosed with math disabilities, which was stated by the National Institute on Deafness and Other Communications Disorders, which is a government-approved website. So how can teachers and parents support children with DLD? So one thing that teachers and parents can do, which is an evidence-based practice, is to check for understanding after giving instruction. So teachers and parents can do this by having the child repeat an instruction that was given to them, or the teacher should explain it again in more simple, child-friendly terms. Another practice that teachers can implement in the classroom is teaching the child self-advocacy. So helping the children build confidence and independence by supporting them when they are in need of extra help. So if the child needs something, the teacher should teach the child to express their needs. And also if they're having a difficult time with something, since children with DLD have a hard time processing language and instruction, the teacher could provide extra time for the child to complete any assignments or activities and things like that. So, a pre-writing strategy is another effective practice that teachers can implement in the classroom to give children the opportunity to plan their writing by using visual tools such as graphic organizers or boxes. In this way, children can organize their thoughts and be able to process language in a different way than hearing, which may cause a difficulty for them. Some other strategies that a speech pathologist can give parents or caregivers is to use visuals to communicate to them. So they can use pictures or use body movements and demonstrations that will help them to improve their understanding, and use simple language and allow the child to respond in their own time. So this was my analysis of developmental language disorder, DLD, and I hope you learned new things about this. Thank you so much for your time and have a good week.